welcome. You're watching the Health Talk session by Yashoda Hospitals. Regenerative medicine has long held interest in the orthopedic space, particularly for the joints which are difficult to treat. So what is regenerative medicine and how does it work? So let's discuss about this topic in our today's episode. I'm Dr. Lakshmi and let's welcome Dr. Krishna Subramanyam, consultant orthopedic surgeon from Yashoda Hospitals, Malakpet. Welcome to the program, Doctor.
Namaste, Andy.
So doctor, to begin with, what is regenerative medicine and how does it differ from the regular conventional methods of treatment?
Regenerative medicine is not a new concept. It is been there almost close to a decade and more in the Indian medical treatment aspects. What exactly the regenerative medicine is? It includes treatment modalities in which the native treatment of human body are being used for the treating various disease problems. For example, we all since our childhood days fell many times, isn't it? And whatever the damaged portion that is there, like for example if there is a cut, it heals on its own, or when we do regular surgical cuts and when they suture them, the body heals them. So the basis is the human tissues. We take them as the treatment modalities in regenerative medicine. They may be tiny injections down to transfer of many major tissues. So that's how the regenerative medicine works. And in this, as the diseased person is treated with his own tissues, that's how it differs from the regular conventional medication. And this is the basis of the regenerative medication.
Yeah, doctor. So could you explain some of the promising regenerative medicine techniques being used in orthopedic space?
Regenerative medicine tools in orthopedics, we call them as orthobiologics. The term itself is self-explanatory, orthobiologics, where the biological treatment modalities are being used for various orthopedic conditions. For example, to give them an example, the common condition in which we use orthobiologics is degenerative arthritis, like osteoarthritis of the knee. 2 is ligament tears. 3rd is tendon tears. Then whenever there is a non-union of the bone fractures. And then the latest post-COVID, we are seeing so many avascular necrosis of the bones. And this particular aspect also we do a lot of orthobiological treatment modalities.
So that means there is no surgical methods involved when we talk about regenerative medicine. Am I right, doctor?
It's not completely true, because to obtain orthobiologics, we take from the patient's own body through various injections and through various processes, and then we use these tissues in the treatment of the patient himself or herself. So to some extent there are no major surgeries, but to obtain these the tissues from the body, we have to use some kind of injection modalities.
Yeah, doctor, I think we get it now. So doctor, what are the different types of regenerative medicine which are being used now?
As I told, the regenerative medicine tools we use in orthopedics are collectively called as orthobiologics. To give an example to you, we use mesenchymal stem cells or adipose based stem cells. So the word stem cells is we obtain when it from the bone marrow, it is called bone marrow aspirate concentrate. And we get it from the fat or adipose tissue. These are called adipose derived stem cells. Then the platelet-rich plasma, what is commonly called today as plasma therapy. These are some of the examples. And one more thing is we use bone morphogenic protein, and another one is synovial fluid replacement therapy, where the native joint fluid is being injected again into the joint. All these come under orthobiologics modalities or regenerative medicine tools in the treatment of various orthopedics and musculoskeletal conditions.
So doctor, we keep hearing the terms such as BMAC, stem cells or PRP. So how different are these terms from each other, or how similar are they?
As I told, orthobiologics includes multiple types of modalities. For example, the common one which I am going to speak is the PRP or plasma therapy, in which patient's own blood is drawn, like for example, from the peripheral vein or a cubital vein, a quantity of 20 ml is drawn. It is processed in a particular methodology, a centrifuge machine, so that we can get a concentrate which is rich of plasma, rich of platelets, which is almost 3 to 5-fold increase of the normal blood. And these platelets, along with some growth factors or cytokines, are called collectively platelet-rich plasma. And this is injected into the patient's diseased part or a target tissue. Like for example, in knee osteoarthritis, we inject into the knee joint. The platelets, which are very rich in concentrate, they release lot of growth factors along with the cytokines, and they try to heal and try to decrease the inflammation. Coming to next is bone marrow aspirate concentrate. Bone marrow aspirate concentrate is we draw the blood from the bone marrow of the patient. This particular bone marrow aspirate concentrate is superior to PRP. Again, this is indicated in multiple musculoskeletal conditions like osteoarthritis, ligament injuries, non-unions of the bone, tendon injuries, etc., etc.
So doctor, someone undergoing regenerative therapy in orthopedics, so how do you think the recovery time is going to be, and when do you think the results will be seen?
First question is, how long it's going to take? It's a simple OP procedure. It's an outpatient procedure. It's a daycare procedure. Coming to when does it start? Usually PRP, it takes a week to 10 days time to start its action to be seen. But bone marrow is not that. Bone marrow aspirate concentrate, it starts working within 24 hours because of its paracrine effect. And is a potent anti-inflammatory. The patient perceives the relief of the pain from 24 hours onwards. Coming to the synovial fluid replacement therapy, it's also a OP procedure. The patient can be injected then and there, and he can walk or she can walk the very next moment. And he starts feeling the relief of the pain within a week time. And the beauty of this treatment is we can combine a synovial fluid with a BMAC or synovial fluid with PRP, or we can inject them individually. That's the beauty of orthobiologics. Therefore, it's an outpatient procedure, a simple procedure, low cost, effective.
I think that's wonderful, doctor. So in general, doctor, are there any group of people who should consider this therapy right away, or any group of people who would benefit with this therapy more?
Having known about orthobiologics, it is though the latest modality of the treatment which has been practiced in the last decade. I have a personal experience of more than 2,000 people. But it is not a substitute for the existing treatments. It is one of the modalities in orthopedic problems for their treatment. So therefore, this orthobiologics is useful only in certain categories of the patient. For example, in knee osteoarthritis. As we all know, the knee osteoarthritis is seen in 4 stages. Stage 1, stage 2, stage 3 and stage 4. That is increasing severity of the disease. Stage 1, there is no requirement of orthobiologics. Stage 2 and stage 3, where the disease is moderate, yes, it is 100% useful. In stage 4, this may not be useful. So where the surgery is mandatory. So that's why orthobiologics have been used or being used in only certain groups of people, and there lies the clinician's edge. He knows whom to give, whom not to give. So therefore, when the clinician feels that this person is eligible, this person it doesn't work, he differentiates in whom this particular treatment is being to be used.
I think that's well explained, Doctor. So before ending this episode, Doctor, what message you would like to give to our audience out there as far as regenerative medicine in orthopedics is concerned?
Regenerative medicine is the newer modality of the treatment in the treatment of various orthopedic problems. It has its own advantages. It is simple, repeatable. What I mean by to say repeatable is, if a person takes a PRP or BMAC or synovial fluid replacement therapy, it can be repeated, unlike steroids, after a few months or a year. I have known people who come every year, take these kind of injections and go back and get the benefit. But having said it, it has its own limitations in the sense it is useful only for certain groups of people, certain conditions of the problems in orthopedics. Therefore, as it is not a substitute to some of the treatments, as a treatment modality, it has its own promising results. It has to be used under the supervision of the senior clinicians who knows whom to give, whom not to give. Therefore, please consult your clinician or orthopedic surgeon and get the benefit if you are a candidate for regenerative therapy.
Thank you, Doctor. It was wonderful having you here on the program today.
Thank you very much.
So this brings us to the end of this episode. Hope this episode was informative on the topic regenerative medicine in orthopedics, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.